Welcome to this short video. I'm Ted Jedinak. You're about to discover super skill number 5 that maximizes your clinical outcomes for your MSK patients. Super skill number 5 that maximizes clinical outcomes for your MSK patients is, when it comes to your patient's MSK conditions, the skill of using tools is essential. When evidence and technology combine, we can end up with new treatment tools to help our patients get better faster. Over my career as a manual therapist, 3 tools have made their way into my daily practice. In fact, these are 3 tools that I'd never work without. Today, you're going to discover why these tools can make a world of difference to your clinical outcomes. So let's start with tool number 1, which is this tool, which I call the Impactor, is also known as a chiropractic adjusting tool. And there's also a trademarked version called the Activator, TM. Now, I won't use the term activator because my solicitor and the Activator Methods legal department have advised me not to use their term. Oops. I've just used their term to explain that I can't use that term. Is that going to get me into trouble? Oh well, I guess we'll find out eventually. Let me tell you a really interesting story about how the Activator actually came about. So there's this chiropractor, he has a headache and he walks into a bar. No, or was it a chiropractor who walks into a bar and that gave him his headache? Anyway, it's not a joke even if it sounds like one. So this chiropractor has a chronic headache and he's had it for over 12 months despite all the treatments he's tried. As it so happens, he has to go to his dentist to have a big molar cavity filled. Now back in the 1950s, they used to fill these type of cavities with gold. So there he is, lying in the dental chair, and the dentist is packing the cavity with gold, and then the gold has to be hammered into place. And the dentist uses an instrument like this called an impactor. So he goes in, and it's like bang, bang, and he impacts the gold in. And after the dentist has finished the job, chiropractor gets off the chair and then he notices that his headache's gone. What? Really? And this prompts him to investigate into how did that happen? And he comes to the conclusion that the force the dentist applied affected the nociceptors around his TMJ, resulting in the headache dissipating. Whoa! And that's how the Activator began, from a chiropractor researching what a dentist did. What a great example of cross-pollination between professions. Hey, what's crucial to know is this. Impactors do not hammer bones back into position. Rather, they tell the brain the desired effect, and then the brain activates the muscles to help out. It's a bit like when you're in a crowded cocktail party and there's people everywhere, you're looking around and then you feel someone tap you on the shoulder. You know how you get a bit of a start and you turn around? Well, that's what the impactor does. The brain gets this rapid impulse and it goes, who's that? Or what's that? The impactor does not hammer bones back into position. I think of the impactor as being like the icing on the cake of my treatment. My manual therapies, like the mobilization, the manipulation, that's the cake. And then the impactor is the stimulation to top it all off. It's like the icing. And that's why I wouldn't work without an impactor, because it contributes to the most comprehensive manual therapy service I can provide. The second tool that I'd never work without is this precision instrument is brilliant at detecting and correcting fascial densities or irregularities in the fascial linings of muscles, ligaments, tendons. You know the term trigger points or pressure points? Well, this tool kind of works like a stylus on a vinyl record. It detects and amplifies any irregularities so that you, the practitioner, can feel any densities or restrictions that might be contributing to your patient's MSK conditions. So the great advantage of the TAM, or the tool-assisted massage, is that the tool amplifies those irregularities so that you can detect them with ease, even if your palpation skills are not particularly well developed. This tool speeds up your MSK assessments and treatments dramatically, and that's why I'd never work without it. Tool number 3 is the drop piece, and it's a fantastic way to deliver high velocity manipulations with minimal effort required by you, the practitioner. They also enable you to control the patient's foot or leg really effectively, which increases the safety level of using high velocity manipulation techniques. FMT Ninja Masters use drop pieces as an integrated part of their protocol. You'll get the opportunity to use a drop piece in our FMT intensive at beautiful Byron Bay in August. It'll take your manual therapy skills to a whole new level. This is a world first for pod peeps. If you're interested in developing your foot manipulation with drop piece technology and get some savings with the early bird rates, simply click on the link on this page for the FMT intensive. Remember, the intensive is only open to graduates of FMT Level 1. Now you'll get the full lowdown on what the training includes, what's new for 2019, and how to save a heap of cash. We already have FMT reviewers enrolled, as well as the clinic owners who are sending their pods along so they too can get even better clinical outcomes. Remember, to upskill yourself with new assessment and treatment skills, you need new training options. To discover what we pod peeps can learn and apply from physio, chiro and osteo professions, click the link for the Advanced FMT Intensive coming up. Thanks for watching this video. It's truly great to work with practitioners who want to maximize their skills so they can help more patients like never before. Until next time, serve with spirit, consult with care, and help more people today.